Good morning. First, I'd like to thank Chairwoman Brooks for holding the hearing today and on the threats posed by bioterrorism. I would also like to thank Chairwoman Brooks for allowing my friend and my colleague, my mentor from the Garden State, Congressman Bill Pascrell, to participate in today's important hearing. As a former member of the committee and a leader on bioterrorism issues, I know we will benefit from his expertise. I commend both Mr. Pasquarello and Mr. King, the lead sponsors on the WMD Prevention and Preparedness Act, for their efforts to comprehensively address the threats that are posed by weapons of mass destruction, particularly biological weapons. I admire their bipartisan effort and their persistence in championing this legislation that will implement many of the recommendations of the bipartisan WMD Commission. I look forward to doing my part to help advance the bill. As a freshman member, I appreciate this opportunity to explore the threats posed by weaponized pathogens and what we can do as legislators to address them. During my preparation for this hearing, two things stuck out to me. First, without a special assistant to the President for biodefense, there does not appear to be a unified, coordinated effort for addressing these threats posed by biological weapons. Second, we are not where we need to be with respect to caring for children in the event of a biological attack. To my first point, it seems that the federal effort to address bioterrorism ebbs and flows. In December 2009, President Obama signed an executive order that outlined a process for the federal government to deliver medical countermeasures. Shortly after, the administration created a federal working group tasked with designating this high-risk Tier 1 biological select agents and toxins. The release in July 2012 of the National Strategy on Biosurveillance that emphasized the need to coordinate among federal, state, and local governments, the private sector, was a really positive step. However, since that time, specifics on how to carry out the strategy have not been forthcoming. As a result, efforts continue to be disjointed. I'm not alone in reaching this conclusion. GAO stated in its testimony before this subcommittee in 2012 that the national biosurveillance efforts continue to be without a system to determine current resources, assess risk, and prioritize investments. This mission is too critical to be without a coordinated and consistent federal framework. To my second point, I'm concerned as a nation, we have not done enough to ensure, in the event of a biological attack, children get the care that they need. It is well understood that as a population, children may experience biological reactions to weaponized pathogens more quickly than adults. There is a very healthy and active debate about the development and provision of countermeasures to children. Last April, the GAO reported that 40% of countermeasures in the Strategic National Stockpile were not approved for the use on children. I understand that last year, the President's Commission for the Study on Bioethical Issues released a report entitled Safeguarding Children, Pediatric Countermeasures Research, to make recommendations about carrying out research for medical countermeasures for children. Aside from the question of developing and stockpiling countermeasures for children, there is the matter of treating children in such a disaster. I am concerned that in recent years, the advent of the federal support for public health, such as a termination of funding for the Metropolitan Medical Response System and its vital programs, local public health personnel do not have the training necessary to treat the unique needs of children who have been exposed to weaponized pathogens. I look forward to learning more about these issues from our witnesses. I want to thank the witnesses for being here today, and I look forward to their testimony, and I yield back. But Madam Chair, before I yield back, that was in the script. Before I yield back, you know, I had a situation when I was the president of the Norton Municipal Council that an envelope was mailed to my home and mailed to several other council members during our tenure. And one of my children's jobs is to get the mail. Luckily, this day, my wife picked the mail up, and a powdery substance had been mailed to my home. And several other council members, the other council members, it was mailed to City Hall, but this one was mailed to my home. So, you know, I have an experience with what this could potentially be and mean to citizens that we are here to protect and serve. So I just wanted to add that this is very, very important work we're doing and the witnesses, and it's very personal to me and what it means to children. Thank you.
Thank you, Congressman Payne. And